Rusty Wallace Hyundai. That's where my wife and I bought our new 2025 Santa Fe, and she says it's the best car she's ever had. We couldn't be happier with everything. Their team was great through the whole process, and their service department is top-notch. Check out their new location at 505 Callahan Drive in Knoxville, Tennessee, or at rustywallacehyundai.com. Let's go ahead and get it kicked off. Dr. Mike Beeler, DDS.
Yep.
I hope you can send me kind of a bio that we can put in there and kind of fill you all up, all the good stuff you've done and where you're at.
Okay. You want me to just give you a quick rundown?
Of course, that'd be great.
Well, I have just retired and from private practice, but I went to undergraduate school at the University of Tennessee at Martin over in West Tennessee and grew up in Martin. That's where I considered that I grew up. My dad was a college football coach. My mother was a high school English teacher. So therefore, my calling is I want to change the profession of dentistry for the better. Now, how can I do that? Well, Pat Head changed basketball, women's basketball. And I went to school with Pat Head over at
Did you really?
Sure did.
Yeah.
So if she can change women's basketball, of course, she's on a national stage. And this is the beginning of a national stage right here,
Of course.
Stephen.
Yeah, this is it.
Yeah. So
Maybe international.
maybe you never know. Depends on how radical our discussion gets, I guess, as to how many people want to tune in. But my dad was a college football coach and mother high school English teacher. And so I feel driven to do what I can to help dental students. I want to teach other dental students, and I want to give some lectures and presentations and maybe do some stuff online. Who knows, maybe podcasting, see how that turns out.
And you're no slouch either. You played college football, and I'm pretty sure you smoked me at racquetball a time or two.
Well, that
at
was
some
back
point in time. Not that many years ago.
I can't even walk down the stairs now without holding on to the rail because my knee gives way. But yeah, I was a pretty good athlete. I'm in the Hall of Fame. UT Martin hold a bunch of records for played defensive back, and so a bunch of records for most interceptions in a game. Can you imagine 4? I don't want to brag about it, but I'm old, so
wow, you should.
So. And of course, we were playing in elementary school, so. No, I'm teasing. We were playing a really good team, and I was on a good team. And so got in the Hall of Fame. My dad is in the Hall of Fame at UT at Martin. So first father-son Hall of Fame thing going on.
Yeah.
But and I wanted to go on and play professional football. I'm 5'7" now. I used to be 5'10". My dad was 6'3", and they thought I was going to grow, and I didn't. So anyway, I did have the opportunity to try out on some pro teams, and mainly Canadian. And so then I decided I was going to go to dental school instead of the University of Saigon because I was of draft age and my draft number was 22 and all that. So I get into dental school and get out of dental school and decide, okay, what am I going to do? Well, I'm going to have to be a dentist. Well, I don't know how to run a dental practice or dental office. So I went in practice with my uncle in Knoxville. That didn't turn out too well because he just he wasn't a good teacher. And I really needed that. They teach nothing about business in dental school. So I went into practice after being in his office for about 9 months, 6 to 9 months. I joined another practice in North Knoxville and Fountain City, and we had 6 general practicing dentists and 4 general practicing dentists and 4 specialists. So 8 total. 9 counting me, and I learned a lot. It was like a 12-year residency. So I've learned everything in dentistry.
And that's pretty neat. I never thought about the fact that, like in dental school, they don't teach you how to run a business. That's a whole different class, whole different school, and you don't get that generally, right?
You don't know how to hire. You don't know how to fire. You don't know how to go to the bank and borrow money. You know nothing about contracts. You don't know how to talk to your accountant. You don't know how to balance the books. You don't know anything. It hasn't changed much either. So that's part of what I want to try to help other young dental students so that when they get out, they can have a better chance at making it in private practice if that's what they want to do.
Yeah.
Just as a side note, I was talking to a my wife's brother, who has a son, so it's my nephew, who either has a chance of going to University of Georgia or the University of Tennessee. He got accepted to Tennessee. He's in state in Georgia. And if he goes out of state, it's $50,000 a year.
Oh, man.
So 4 years, $200,000. And if he wanted to go to med school, dental school, another $350,000, $400,000. So when you get out of dental school, you owe $300,000, $400,000, $500,000, however much you owe. And now go get them, boy.
Yeah.
Go start your business.
With no baseline of how to do that.
Correct. So dentists get out of school today and they join a corporate business, dental business. And they learn on the fly, so to speak, on patients. And they move around a lot until they find they can settle in someplace. So, but they have to learn from corporate America. And corporate America is not relationship-based dentistry. It's just wham, bam, thank you, ma'am, here it is,
Which for the general consumer, that's kind of what we think we need, right? We show up, we get our teeth cleaned when our insurance says we can. If we need a filling, we get a filling and we leave, and we know nothing different.
Well, many patients, many dental consumers have DIDS, dental insurance dependency syndrome. And what you just said was, well, we have to see what our insurance says we can do.
That's right.
And that's the mindset of a lot of dental consumers today. But one of the things that I want to change is get the message out that the mouth is the most important part of our body that we voluntarily use. In other words, our brain normally works. Our lungs, our heart, everything normally works. We don't have to think about it. But with our mouth, we decide what we're going to put in it and words that we're going to choose to let come out of it. So
you're right. Yeah.
When I'll never forget when I was at a dental meeting one time, and all you got to do is just let me sit in front of a microphone. You don't even have to ask any questions. You got to slow me down.
No, you're doing exactly what it is. So we talked kind of briefly about some of this and some of the things you were coming off with as a general consumer who has teeth.
Yeah.
Didn't realize anything that you mentioned. So I'm excited about getting where we're going on this.
Well, but we have to change as a consumer. So in order to change, there are 6 steps to change: awareness, understanding, concern, dissatisfaction, action, change. But it's true, until we become dissatisfied as a consumer, we're not going to gripe too much about it.
And with our teeth, when we were dissatisfied, it's already too late.
Correct. When you're having pain, you're dissatisfied. You don't have to really do anything. We might touch on the 5 different types of dental patients that there are, the 5 different types of dentists that there are. I went to Google before coming here this afternoon, and I thought, well, I'll ask Google what the most important questions that the dental consumer in America would like to know about dentists or dentistry. And so I brought my cell phone, and we can put it up to the cell phone, up to the microphone if you want to, and they will tell you in about 30 seconds, what most consumers want to know.
It's probably very general, right?
It is very general, but most of them want to know, well, how can I keep from getting a gum disease and cavities? Well, number one, we have to change the way we think about things. For example, I'm going to ask you, and I don't remember if we talked over the phone the other night, and I mentioned this to you as we were talking, or as I was talking. I don't know if I said, do you think that dihydrogen monoxide is bad for you?
You did mention this, and I thought it was super cool, and I've told a couple people about it, because every time I think of that word, and I can't repeat it, but I just hear it in my head, I think it needs a warning label.
Yeah.
Yeah, something with a warning label.
Dihydrogen monoxide.
Yeah.
Well, we think of carbon monoxide, that's bad. So
it's gotta be
dihydrogen monoxide.
It's got di in the word.
Yeah.
It's got to have a warning.
It's water.
That's crazy.
It's H2O, So a lot of times people will say, well, what can I do? What mouthwash, what toothpaste, what hydrogen peroxide? Hydrogen peroxide? Yes, it's H2O2. It has an extra oxygen. That's the reason it bubbles. So we should use that instead of mouthwash.
Hold on. When you say hydrogen peroxide, you're saying it's pretty much water with an extra oxygen?
It's H2O2. That's the chemical compound.
Okay, so the only time I've ever thought of hydrogen peroxide is like when you get a wound. Back in the day, they'd clean it with it, and then they said to stop cleaning wounds with it. So I'm not sure what we do with it, but now we can.
Well, you can find it in the Band-Aid.
Wash your mouth with it. That's awesome.
Well, you can't. The big companies, the big manufacturers of mouthwash can't make any money on hydrogen peroxide. You can buy it for 98 cents.
Yeah,
64 cents at Kroger. Somebody was telling me the other day.
Huh. So does it give you that same clean feeling that you get from the mouthwash?
Well, it doesn't bubble. Mouthwash that you buy, on the toothpaste and mouthwash aisle doesn't bubble. Listerine's 29% alcohol.
That's why it burns. It gives you that good, I got a clean feeling.
Let's rinse our mouth out with gasoline. Maybe that'll kill some bacteria.
And I think you've said before, or maybe Terry, my wife, who's worked for you in the past, said that it dries your mouth out so much and creates a dependency that we can't move past, right?
Well, either that or you like the alcohol content of it. I don't know, but you'll see Listerine in a lot of dental offices, and a lot of dentists would use it for patients who salivate too much. If there's too much saliva,
okay. So if you're a spitter when you talk, you can use some alcohol. Dry it up.
Yeah. So I tell patients, look, the ones that I advise now, which little kids who I'm advising now, so they don't really ask that much, but their parents do. And I say, don't waste money on Listerine and Scope and all these fancy mouthwashes that don't whiten your teeth and don't do this and don't do that. I wouldn't want someone to say, well, we're going to file a lawsuit because of you're saying that it's not effective or whatever. The American Dental Association has given its seal of approval. So it's bound to kill bacteria. Well, maybe it kills bacteria, but hydrogen peroxide works a whole lot better, in my opinion. It's both bacteriostatic and antiviral as well.
Huh. I'll have to give that a shot. That sounds interesting because I'm not usually a mouthwash guy. Yeah. But I love that crispness and clean feeling I get from it, Well, so I guess that would be the same thing.
It sounds like an advertisement, but it's basically 97% water. It's only 3% hydrogen peroxide. So your grandmother or great aunt or somebody will say, oh, you need to dilute that. No, you don't. It's 97% water. Well, what if you swallow some? Well, that's okay. It's not going to hurt you.
Does it not?
It's hydrogen and oxygen. Hydrogen and oxygen won't kill us, H2O.
What is it you give dogs if they swallow something that they're not supposed to? You give them hydrogen peroxide, right?
No, you give them Miller Lite, man. I don't know.
But I do think that's a thing with dogs. Okay, thanks, Savannah.
Yeah. I don't know.
The producer for the show. Thanks for...
Well, now, I'm going to look at... She's a much more attractive person to stare at than you, Stephen, although you're a handsome young man.
Well, thank you.
But it's okay for me to look to the left every now and then? Is that...
Yeah, we don't have a camera for her yet, but I think that's in the workings. But, she's here to help out and to feed info to the show as we need it. So that's perfect.
Well, and she's been in dentistry for, 7, 8 years or longer? Yeah, so she joined the conversation, she knows what's going on and she can participate if this is, I hope it'll be a part 1 of 3, because at the end of this, I want to ask some questions maybe for patients or people who are interested that might be listening to follow up and ask for a follow-up podcast or, just email or whatever.
I think that'd be great. And based on all the information you kind of fed towards me, I don't think we can cover it all in one episode. So that'd be awesome.
My wife was telling me today, I brought these, this sheet of notes, I guess, that I wanted to try to follow. So I just wouldn't ramble because I can go for probably 3 or 4 hours, without taking a break.
Yeah. that's great.
Mouth of the South, or whatever. But she was saying, you're really delving into it much more deeply than the average person might be interested in. And I said, well, I guess I am. Stephen will guide me.
Yeah, no, I think we're great. I think as long as we're hitting on what the general consumer doesn't know, and I think that's where your wealth of knowledge is, and that's going to be great. So, one of the things that you've got on here, and I love that you sent me some notes, what to expect during a hygiene appointment. That's a cleaning, right?
Yes. And that's a great question. And I think that it depends on the type of dental office that the patient is seeing. The first question that anybody asks when they call a dental office is what, Savannah?
Does my insurance cover it?
Yeah.
Oh, yeah. Does my insurance, or what do you charge for?
Yeah. What do you charge for, or do you take my insurance?
Yeah, exactly.
That's almost the first question. And that's a good question for patients to ask, but that's not the most important question to ask. And so I tell people, they say, well, we're moving out of town. We hate to leave your office. You've been our dentist for 10 years, 5 years, 3 years, whatever. And we're going to move to Nashville. Do you know anybody in Nashville? And I might know one or two, but they're probably already retired. And I said, well, let me just give you 4 questions to ask. The first question would be, how long are your dental hygiene appointments? And if they're not at least an hour long, they're not going to be as thorough. So are you looking for somebody, you just want a 15-minute real quick look-see, polish my teeth real quick? And there are patients that do. Or do you want to have somebody that does a more thorough examination? So question 1 would be, how long are your dental hygiene appointments? And if they're not an hour long, personally, I wouldn't want to go. Now, there are some good dentists whose hygiene appointments are 30 minutes, 45 minutes, 15 minutes, whatever they are. So I'm not trying to degrade any other dentist or their offices or anything else.
Is there a standard set of procedures that you should be going through and getting?
I think there should be. That's one of the things that I want to try to teach dental students, so that we will become a little more standardized in the care that we're offering to patients, or at least patients can say, okay, well, do you, after the patient asks a few questions, do you take my insurance? Oh, yes, we take everybody's insurance. Well, I don't know. That's a little bit of a red flag for me, because now the dentist is catering to dental insurance companies, and dental insurance companies are wanting to pay as little as possible. Mm-hmm. And that's just the way it is. So that would be the first question that we have to answer. Do you take my insurance? And it should be, how long are your dental hygiene appointments?
And that makes sense. So I fell victim to TikTok.
Yeah.
I watched some people have a water flosser.
Yeah,
and they seem really great. And I went and bought one, and I was talking to my cousin, and he'd done the same thing at a different time.
Yeah.
And man, the first thing I did is you put it in there, and next thing I know, it's a bloody mess, and there's water everywhere and blood everywhere, and I've made a big mistake. So I was telling him, I said, yeah, it's like when you go to the dentist though, and they use that sandblaster, which I'm sure it has a more professional term. And
air abrasion, but not most.
He said, no, mine don't have that.
A lot of dentists don't use it.
And I go to the dentist where you retired from, and they have all that equipment. And he was like, I don't even know what you're talking about.
Yeah, most of the time, the dental hygiene has really not changed since I got out of school in December of 1975.
Okay.
So a long time ago, and they used to use pumice, and they put it on a little rubber cup, and then they would pumice your teeth off. And most dentists,
pumice, is that like a honing, like a polishing?
It's a flavored volcanic pumice, you might say. It's a little abrasive.
Okay, you're gonna have to break that down. You say, and is pumice a general term?
Yeah. The little cup they do at the very end after they've scaled your teeth?
That was just to make you feel good and polish it up, though, right?
Yeah, just okay. It removes soft.
Yeah, that's just out of my
like
word jargon, I guess.
Think that's the cleaning, though.
Yeah, that's just the part that feels good and tastes good.
Yeah, and that's what most dentists do, and that's okay. On a scale from 1 to 10, it is, I think, about 5.
Yeah.
But I think there are offices that do have a little more modern equipment. Second question I was asked is, does the hygienist wear lighted magnification? And if the hygienist doesn't wear lighted magnification, then they're not going to be able to see as well if they're going to remove the hard deposits when they're using hand instruments, or if they use some sort of automatic scaler.
Of course.
Third question would be, do you use digital x-rays? Because you have less radiation with digital x-rays. And the last question would be, do you use intraoral cameras to take pictures? I want to be able to see my teeth. I want to see my fillings. You tell me that I have a cracked filling. You say that this tooth is really worn, or it's this or that. Can you show me? And so I think they should have a television set or a big screen TV in each room so the patient can see what's going on.
See, I
So
think
those
I've
are
been
the four
spoiled. I didn't
questions.
realize those were not standard. Like you said, air abrasion. I guess that's what I call the sandblasting.
They call it airflow technology.
Okay.
It's not quite as it's not as abrasive as air abrasion, and it costs more money.
I've never felt so clean as when I leave a dentist's office when they do that.
Yeah,
It's like a whole new feeling.
it's the best. It's what
Yeah.
we should do in dentistry, but we just haven't done it.
It's great, and I would recommend anybody to try it. So moving from there, dental products like toothpaste and
Yeah.
1 in 10 dentists recommend this.
Yeah. I think you should just use the one that's the cheapest that you can buy at dollar store.
Okay.
Or whatever. There is an issue going on now about fluoride. I have
Is it good or bad?
well, it's supposed to be good for our teeth.
Okay.
And for all my life, especially professional life, we did fluoride treatments in the office, or we would apply fluoride to people's teeth. And so it's coming into question that it is not good for us. It's good for our teeth, but it's not good for us to have in drinking water. And with Bobby Kennedy Jr., Robert F. Kennedy Jr. coming in and going to make America healthier again, that's one of the things on the checklist. They want to get fluoride out of drinking water.
Uh-huh.
Now, I don't know about that, specifically about in toothpaste and fluoride treatments in the dental office and that sort of thing. There are people who are higher up on the pay scale that study that than I do, but it is coming in question. But so I've always been trained and taught that you should buy a toothpaste that has fluoride in it. But
that helps with sensitivity in our teeth, right?
It's supposed to help with sensitivity and reduce potential for decay.
Okay.
There are two types of fluoride. One is stannous fluoride and one sodium fluoride. And so there are pros and cons to each of those.
Let's get to the good stuff.
Yeah.
So health insurance, man, I get 14 different options for health insurance with my employer.
Yeah.
I get one option of dental insurance. It's how much money do you want?
Yeah.
That's the only options I get. And other than that, I thought we had really good health insurance and dental insurance, but dental insurance is very limited and completely different than health insurance.
Dental insurance, the way I understand it, and I'm not an insurance expert by any means, but dental insurance is usually just thrown in as a added benefit to the company who is buying the medical insurance. They say, okay, if you buy this medical insurance, we'll throw in the dental insurance for you at no charge. And so they reduce the premium for the people to buy their medical. The way I understand it, I don't know.
That makes sense.
May or may not be so. So the patient is stuck with whatever insurance that their employer wants to buy, and they can have one or two or three choices. Now, Savannah knows a whole lot more about that than I do, even though it's been a while since you've been in dentistry, but still, it's a big deal. I call it DIDS, Dental Insurance Dependency Syndrome, and we all have it.
Yep.
And the thing that is upsetting to me whenever I go to a medical doctor, which I've had to go a little bit more frequently, going to have my knee surgery done, total knee, and had some eye issues, and that's about it, thankfully. I don't have any other issues. But when I go to pay, I never pay. I never have to pay. And I didn't before I was 65 either. I just go in and throw in my insurance form, or, they'd have it on file and they'd say, well, you owe us a $15 copay. And that has really hurt us in dentistry because patients have become so dependent on not paying when they come into the dental office. And we're recommending to them that they need to have this procedure or that procedure, and it's going to cost $1,500. The insurance is only going to pay half or sometimes less. And they go, well, golly, how am I going to work this out?
What's the cheaper alternative? What else can I do?
What else can you do? Yeah. So, that's dental insurance is a big deal. I think medical insurance. Did you know that the mouth, if it is the most important part of our body that we voluntarily use, whenever treatment is rendered on the mouth, medical insurance does not pay. On any other body part, medical insurance pays. They said, well, your eyes, for eyeglasses. Well, that's not surgery. It pays for cataracts. It pays for other kinds of treatments that are being done surgically. Well, in dentistry, we're doing surgery. Oh, it's just a filling. Well, we're drilling on human tissue. We're repairing or restoring human tissue. So to me, that's one of my main goals. I want the mouth to be included as part of the human body. And I'm going to repeat it 2 or 3 times. You cut it out when you're doing your edits.
Yeah, no, I think that's great. If that's a belief you got, I like it. I think that's something we stand behind. But what do you mean as far as like we won't have any more dental insurance?
Yeah, we don't need dental insurance.
Okay.
If you I happen to know you, and because your wife was a dental assistant working with me for 25 years. It's 25, 26.
Somewhere in there. It was a long
Savannah
time.
made it. People usually don't make it that long working with me. Savannah made it 9 years or however long Savannah did. And, great. Can't beat Savannah or Terry. Your wife's the best dental assistant I've ever worked with.
Thank you.
She
takes a lot of pride in it. She likes it.
But like a lot of people, likes doing what she does. And so learning wasn't a chore for her, and she embraced it, that sort of thing. But as far as our question, where did I go? I got wound up, and went off on a
Is dental
tangent.
insurance going away?
No. Well, I was going to say, in your case, you don't need dental insurance. Savannah doesn't need dental insurance. If you have an accident, a car accident, for example, car insurance will pay. If you fall at home, a slip and fall and chip a tooth or break a tooth, homeowners insurance will pay for it minus deductible, or it should, depending on the kind of policy that you have. I'm not an insurance expert, but people don't need dental insurance.
But now what about our cleanings? Because that's free, right?
What? Pay for them? What about when you go play golf? You pay for it, don't you?
No, of course.
I mean, I'm not saying you. I don't mean to be
in general,
attacking.
the you as a person, as people.
Yes, but the medical insurance should pay for all cleanings, all fillings. They should pay for braces for little kids if they need a retainer. They should pay for anything that is related to our teeth or mouth. Headaches. Half the women that have headaches probably have a dental connection.
It's because I make my wife grit her teeth and chomp her mouth the whole time. It's all my fault.
We men can do that. There's no question about that.
No doubt.
That's for sure. I think we grow out of it. I think I started growing out of it when I was about 70 or something like that.
I was going to say.
Yeah, I don't think so.
I thought you were going to say 17.
No, but so the reason I say we don't need dental insurance is because we have other insurances that would cover any injury or accident that we might have. But if medical insurance were to, if our teeth and mouth, 70% of our mouth is soft tissue. 70% of our mouth is soft tissue. And so we dentists and patients focus on hard tissue, meaning the teeth. And is the tooth abscessed? Is it decayed? And we look at x-rays, and I know some dentists who just stare at x-rays. They just stare at them. I go, what are you staring at? Well, they're looking for decay in between the teeth or underneath the filling or underneath a crown or whatever. And in my opinion, they should be looking at photographs, diagnostic photographs. So I think every patient who comes into the dental office should have at least 40 extraoral photographs. And I'm actually going to teach a course on dental photography, and I call it Systematic Diagnostic Dental Photography.
So I like that. You're saying that that's kind of a preliminary finding before you have a cavity.
Well, it allows us to see gum tissue. It allows us to see cheeks under the tongue. Is the patient tongue-tied? Does the patient have a small airway space as far as patients having obstructive airway disease and they have sleep apnea? When do we let patients know? When they're 50? When they're 65 and they've been snoring ever since they were 30? And it's because they have a small airway space? And so it is...
and those are things connected to dentistry?
Yes, it's in the mouth. The mouth, we breathe through our mouth and nose, but sometimes people have allergies and they can't breathe through their nose. And it starts when kids are 2, when they're 1 or 2 years old. And so we need to be looking at the back of their throats on young kids as a general dentist. I think the general dentist is the most important healthcare professional that patients see. And it's not the most important when you have a heart attack.
Mm-hmm.
It's not the most important part, a medical doctor, when we have a car accident or we have something major. I'm not belittling any of those, but I'm saying for a long-term relationship, the orthodontist you're going to see for 2-3 years, 4 or 5 years. How long is the relationship with the orthodontist? How long is the relationship with the pediatric dentist? The pediatric dentist sees the dentist until they're 10 or 11, maybe 12, and they go see a general dentist. And so the gum specialist, the prosthodontist, the root canal specialist, the oral surgeon that you get wisdom teeth removed, you don't see the oral surgeon anymore, generally. But that general dentist, you're going to see, if you like him or her, for 30, 40 years. I had patients that I saw for 30, 40 years, and I became part of the family. And that's
right.
really some of what I miss.
And I get that. So to back up just a hair, we were talking about toothpaste. We were talking about mouthwash.
Yeah.
What about flossing?
Well, flossing's pretty important. Now, the dental floss, the kind I like the best, has Teflon. And Teflon is not good for us. That's supposed to be a no-no, our Teflon pans and stuff like that
really?
as far as cooking.
Oh, yeah.
And Teflon and microwave popcorn, we need to be checking that out.
Yeah, because they always ask you the question, have you been flossing? And I know they know because they can see in my mouth,
Yeah.
Like at first I always used to try to lie to them. And then I became older and more aware, I realized that it's not tricking anybody because they can see the proof and the evidence.
Well, they need to use, what do we call it, Savannah? Our solution that we use.
That purple stuff?
Plaque disclosing solution.
Yeah.
And it will, and we give these little chewable tablets to kids, and they can chew them up and see where they're missing, because mom or dad can come in and go, okay, let me see.
Mm-hmm.
You still got some on your teeth. Go in there.
So you say that highlights all the
plaque.
All the plaque.
Soft,
okay.
The soft material albut's a fancy word for it.
That wouldn't be like the food
biofilm.
we just ate. That's stuff that's like dug in there, right?
Yeah, it begins to form something like 10 minutes, 30 minutes after you brush your teeth.
Yeah.
So, there's plaque already on my teeth. It's the biofilm is beginning to form on your teeth, my teeth, not on Savannah's teeth, but on the rest. But,
Say biofilm. Is it like a biochemical reaction of bacteria on our
yes.
food? Yeah.
Which sounds worse to you? Decay, you have a cavity, or you have bactofungal disease.
Dude, that sounds awful.
That sounds terrible, doesn't it?
Like I got the plague.
Yeah. So I think we in dentistry don't need to scare people, because in dentistry, we scared people enough back in the 1800s, 1700s, prior to probably 1970 or 80 maybe.
Short of the boogeyman, you're one of the scariest people around.
That's right. And I hear that all the time. I used to, when I was first a dentist, right out of school, people might ask me, so what do you do? And I said, well, I'm a dentist. And they go, well, you don't look like a dentist. And I always wondered what a dentist looks like. So now when I go someplace, I've been doing it now for 48, 49 years. What do you do? I'm a dentist. They go, you look like a dentist.
It's like the dog,
I think
start looking like the owner.
Yeah, it's the circles under the eyes and the bald spot, and you're all hunched over from bending over patients all this time.
So Terry, my wife, you said she was a dental assistant.
Yeah.
She said it's weird. It's the only profession, the only place you work that people tell you every day, I didn't want to come here. I didn't want to see you. I really hated I had to come.
Well, most of the patients that I saw didn't mind coming to see me or Terry or Savannah. Is that so, Savannah?
They liked us as people.
Yeah.
They just didn't like what we were going to do.
Of course, yeah.
And if they didn't like
the drill and the shots,
if they didn't like what we were getting ready to do, we'd put them on nitrous oxide. If they were still nervous or upset, we can pre-medicate them, give them some Valium or something. Not, indiscriminately.
But those are options for people that are scared.
Options that people could have.
And that's awesome.
And those that are really apprehensive, there's sedation dentistry. There's a short-acting barbiturate that they can use for not just any dentist. You have to have the training and that sort of thing. But you can have your dental work done and not be put to sleep. You just don't, you're just not as aware of what's going on. And so that's an alternative for people who are very apprehensive. But I think once they get used to the dentist or the team, and we cut up a little bit and that sort of thing. Every office is different. I know dentists who don't say a word. They say open, close, see you.
Yeah.
And that I can understand why those people might be a little bit more apprehensive, because they don't feel as comfortable with them being in the chair.
Hey, this is Pastor Corey. Would love for you to go check out our podcast, the Just Jesus Podcast. And if also you would like to go on our website, justjesusnow.com, you can check out some of our church services and some of our merch. Be blessed.
And so if you had to put a value on teeth as a dentist, how would you do that? Is it priceless?
Well, if I asked, one of the things I was thinking about, and this is sort of a crazy story, and you know me pretty well. Savannah knows me much better, and your wife knows me much better as being a crazy person. But I will go down what I call go down the wormhole from time to time. And so I never will forget, it's been probably 7 or 8 years ago, maybe more. And it was on a Saturday morning, and my wife said, you been going down the wormhole? Because I like studying things. I like trying to figure out how this happens or that happens and that sort of thing. And I said, yes, I have. And she says, well, what is it today? And I said, toilet paper. And she said, what? And I said, yes. Did you know that people in the United States use more toilet paper than any other country in the world combined? And she said, are you kidding? And I said, yes. People don't use toilet paper in China or in Saudi Arabia.
Is that where they use bidets? Or they don't use anything?
But in a lot of underdeveloped countries like India and Africa, they'll use a pot, and they'll use their right hand to hold the pot of water, and they pour it down their behind, and they use their left hand to perhaps get rid of any debris or excess that they have. And I guess they air dry. I don't know. But maybe that's where the bidet sort of came along. Of course, a little
kind of
bit.
The same thing.
But when you think about it, there are no trees in Saudi Arabia, or very few, and so we have an abundance of trees in the United States. So we use a lot of toilet paper. So what you asked me about the value of teeth. So I wanted to know how much we were spending on toilet paper. If we spend that much on our exit opening, well, how much do we spend on our entry opening? And so that is sort of gross to a certain degree, but I did some calculation, and I was telling my wife, did you know that if you start using toilet paper by the time you're 5 years old and you die at 70, then you've used toilet paper for 70 years. If you die at 75, get my math right. And the average person buying average toilet paper at an average price today for the next, 70 years, you'll spend $120,000. Now that sounds like a lot. And I thought, people, I ask them, I look in their mouth, I know how much they spend on their teeth. Just by looking, I can see that the work that they've had done many times, if they're 45 or 50 years old, they have fillings that they had done when they were 15 or 16 years old that mom and dad paid for. And they didn't ever pay much money for their teeth. And now they need to spend $15,000 or $20,000 on their teeth. They go, $15,000 or $20,000? Are you kidding me? Well, you're going to spend $120 on the hiney. Seems to me like you could spend a little bit more here. So there are 4 things that people need to use their mouth for. Number 1 is survival. We will die within 3 to 4 days if we don't get any water.
Okay.
And where are we going to get that water? Now, forget the food. I mean, just 3 to 4 days. So then 2 is nutrition. 3 is spouse selection. My wife would have never wanted to be attracted to me if I were missing my 4 front teeth.
Of course, yeah.
So spouse selection, intimacy, also it's somewhat of an socioeconomic indicator, in our society in America today. And the last might be how much money you're going to make or your professional opportunities that you might have. So I figured that the value of teeth is about $8,000 a tooth.
Okay.
And so
how many teeth do we have?
We have 28 teeth, subtracting our wisdom teeth.
Okay.
So 32 if we have all of our wisdom teeth, and if we have our wisdom teeth removed, then it's 28. So 28 times 8, and it comes out to about $225,000.
It's a lot of money.
Yeah, but our mouth and teeth are worth, if you have a beautiful smile, what's that worth? 100,000. 100,000.
Okay. So,
Michael Jordan, if he were doing some big fancy commercial and he didn't have a beautiful smile, he's not going to be doing that commercial.
of course.
So
when's the last time you saw a commercial with a guy missing a tooth or a black tooth or a silver tooth?
Right.
That's not supposed to be silver.
Yeah. And then if you have a well-balanced occlusion, then that's another 100,000. So you add it all up, it's $425,000. Now, I made that up.
Okay.
I just made it up.
But it sounds good. It sounds right.
Well, the reason I came up with the 225, a little too much information, really, but I think we have to use that to help patients better understand and see the value. Value equals benefit minus cost. And so we dentists, we focus on cost because our patients have sort of pushed us into that corner. So we have to, how much is it going to be? Well, how much is it? Well, how much is it? So it has become commoditized and monetized.
Mm-hmm.
So everything's monetized almost, you could argue. But how much you charge for heart surgery? I need to have a hemorrhoid operation. How much you charge for that? You got a special on that going on lately? I need to have my tonsils out.
It's got to be done. Let's do it.
My appendix has got to be removed. How much are you going to charge me for that? And call up different doctors' offices saying, how much you charge for cataract surgery?
No, that never happens. Yeah.
But in dentistry, it happens all the time. How much you charge for taking a tooth out or doing a filling, crowns, whatever it is. And I get it. And I would do the same thing because that's the mindset that we have today. So
quality in dentistry is completely different than like healthcare, I would think.
Well, there are varying degrees of quality, just like you want the Ford or you want the Mercedes, and what's the difference? And we have to educate patients on the dental side, and we have to educate ourselves and as a dentist, and why is it better for this patient to have this particular treatment, and for another patient, they would not need that same treatment because this patient takes better care of their teeth than this patient here. Mm-hmm. This patient is more susceptible to, their lifestyle habits because they smoke, they drink, they do karate or whatever they do, so they're a more high risk patient. So if I had to have 2 teeth removed, front teeth, after you left, Savannah, or after you...
This is you. That really happened.
This is me. Really happened to me. Yeah, I had a front tooth break off that had a root canal, and teeth that have had root canals become brittle after, 10, 15 years or so, and so they can fracture, crack, and break depending on biting forces. So I had a front tooth that broke off at the gum line, and here I am a dentist. How you doing?
No teeth?
Yeah. Who's your dentist?
Me. I am.
Yeah. Well, Savannah was, and Terry were, and these other ladies that worked were, because they were very good at what they did, so they could patch me up a little bit.
Oh, that's funny.
And then I had another front tooth break off, and so Terry said, "Okay, you got to do something now. You're going to have to get an implant or a couple implants." So I did. So I went to an oral surgeon and had for a tooth removal. The fee is probably around $500. To have an implant placed is probably around $3,000 or thereabouts, $3,500. Depends on the type of implant, where it is in the front, whether it's in the back, this and that. And the third expense is the crown on top of the implant. So it can cost as much as $8,000. That's how I came up with the $225,000, $8,000 per tooth, blah, blah, blah.
So I've had some cavities.
Yeah.
I've had a couple crowns, but I've never had a root canal.
Yes.
So where do those lead in? Shucks, is a cavity just a crown? A crown's a bigger cavity?
Well, a lot of times...
I just do what they tell me to do at the dentist's office, like most people.
Yes. Well, and, you trust who you've seen, and your wife is working in the dental office, and she's going to guide you, and, you're going to... You make good choices, have made good choices. Little kids have enamel that is about 1/20th as thick as permanent teeth. See, as our permanent teeth, all the primary teeth come in around age 2, and they are all lost by age 10. And so you figure, you're only going to keep your baby teeth for 10 years. And it's easier to get a cavity in a crevice of a molar tooth, a back tooth, because the toothbrush bristles just can't get down in there.
Mm-hmm.
Little kids are eating gummies, and that gummy stuff gets down in these cracks and crevices and they can't clean it out. Then it produces, so the bacteria mixes with saliva and it produces an acid. The acid, demineralizes enamel. It softens the enamel. So something that I read recently about decay was that vitamin D, most of us aren't getting enough vitamin D, and especially vitamin D3 during all the COVID stuff. They said, well, we need to be sure we're getting plenty of, if you get plenty of sunshine, I guess you don't need to worry as much, but that affects our saliva and it helps produce a greater protein that keeps us from getting decay. Vitamin D. I'd never heard that until just a couple of days ago.
First time I heard it, yeah.
So anyway, kids can get decay more easily than adults on primary teeth because the enamel's thinner. And so once we get a cavity you get bactofungal disease, that sounds a whole lot worse.
It sounds awful.
Yeah. And so, but we need to value our teeth a little bit more. And it's sort of scary. Is it going to get in my throat, that bactofungal disease? Is it going to get in my stomach? Is it going to get in my intestines? So I don't want bactofungal disease, but I'm really not too worried about a cavity.
So what's a filling versus a crown? Is it just
a filling is when we remove the soft demineralized tooth structure that has created a hole or a cavity, that's the name.
Yeah.
And we fill that up with a filling material. Now, typically, amalgam has been what's used, which is 50% mercury and 50% silver, and that's becoming, the mercury issue has been an issue ever since I've been in practice. So personally, I stopped doing silver fillings or mercury fillings 30 years ago or 35 years ago. That is still the number one used dental material to
people still use it?
Fill a hole in a tooth, yes. That's all that's used in this area.
That's the ones you got to make sure you don't get aluminum foil in your mouth, right?
Yeah. It gets called galvanic action.
Yeah. I used to worry about the wrapper on gum.
Yeah, chewing gum.
I never did it, but man, you hear stories about it.
Oh,
It was almost like getting electrocuted.
Kisses.
Yeah.
I had a Hershey kiss, and you leave a little on there.
Yeah.
Lit you up when you were little.
Oh.
Filling, you're just filling in a hole. And so there's composite, which is the tooth colored filling material, which is what we should be using. It's better. It's healthier. It doesn't conduct hot or cold changes. And it's what most dentists should be using. It takes a little bit longer, costs a little bit, should cost more because it's taking more dental time and all that stuff. And the insurance companies don't want to pay for tooth color fillings.
And we're back to insurance.
So what do we do? Yeah. So a crown is where there is not enough tooth structure left, and you actually put a thimble over a tooth. You could think of it as being that.
So what's the next step? I've had a couple of those.
Yeah. If the more the tooth is drilled on, the more friction from the drill bit, then the nerve can slowly begin to degenerate or die. And so as the nerve begins to die, then the body's sending white blood cells to the pulp chamber, and they can't handle it after a while. And so then the patient begins to get an abscessed tooth. The white blood cells build up, and there begins to be a lot of pressure. And so then the patient has a toothache, and they say, oh, what am I going to do now? And so back in the old days, they removed the teeth, and today they do a root canal, which is just drilling a hole in the chewing surface up. Usually it's a molar tooth. It's on a front tooth on the inside. And the dentist just removes the old necrotic or rotten nerve tissue and medicates it, that sort of thing, and seals that up so that no bacteria can grow in there again. And so they have had a bad name in the past, and today they can be done painlessly, and it should allow the patient to keep the tooth the rest of their life. However, teeth can become brittle and fracture at a later date, 10, 15, 20 years down the road.
It's one of my favorite procedures to do.
Is it?
Yeah, love it.
It requires a lot of detail, attention to detail. So a lot of dentists, I enjoyed doing them myself.
Man, one of the most embarrassing things I've ever done is I had a cleaning scheduled for 8 a.m. I stayed up late that night before, and I was eating a bunch of fruit roll-ups.
Yeah.
I think I had 8 of them. It
Yeah.
was way too many. And I eat candy, not now, but I did eat candy like a toddler. So I was eating 8 of them. I went in, I sat down, and it was Haley. She was cleaning my teeth,
Yeah.
and she was going through. She stops and looks at me, and she said, did you eat something green? I had to think about it for a minute, and I said, yeah, I had some fruit roll-ups last night. She said, oh, okay. Whew. She said, I thought you had mold growing on your teeth.
Yeah.
Oh, my gosh. Never again. I don't think I've ate a fruit roll-up since that moment.
Well, that's something we need to really advise parents about with their kids.
Yeah.
And we have to just be careful ourselves and not eat too many of them. But,
Oh, yeah. Which I've quit cold turkey now on all candy, but I would eat it like crazy. And, I've had some fillings. I've had some crowns. That's where I was asking, like, man, if I keep doing this, what's next? Do I just run out of options?
Well, what happens is, in my case, if a patient has a molar tooth and they've had 2 or 3 fillings, and the tooth, and then they have a crown prep, and the tooth dies, after having had a crown prep, 3 or 4 or 5 years goes by, and they have root canal, and then another 4 or 5 years go by, and they bite on something hard, and the root cracks.
Mm.
Now, what do you do? Well, you need to have the tooth removed, and you can have the tooth replaced with an implant and a crown.
Yeah.
Now you're getting into bigger bucks.
Well, my final straw was eating a blow pop, and I shattered a tooth.
Oh.
So that was the end of my the end of my blow pops and some other candy, but I've gotten a lot better. As adults, man, our stuff wears out. We can't use them like we used to.
Well, that's to use an analogy, using an automobile, how long do we want our automobiles to last? Well, we'd like for them to last forever, but when we start spending too much money on repairs and parts, then we just trade it in and get a new one. We can't do that with our teeth.
That's right.
But we can, at age 50, 60, at some point, depends on how long and how hard people chew and what their lifestyle habits are and this and that and the other. They're going to need to spend $25,000, $30,000 to replace some of these teeth with crowns, most likely. Now, there's what's called biomimetic dentistry. And I really wasn't doing that, Savannah, when you were working in the office, but I took some courses, and it's really minimally invasive dentistry. And so you want to try to keep from doing crowns. And so the theory is on fillings, if you're a biomimetic dentist, you don't want to do crowns. You do if you absolutely have to. But,
okay.
But that's sort of new in dentistry. It's only been around the last 10, 15 years, something like that. And I was doing it perhaps the last 5 years. And so you can use some fiber instead of just putting a filling in the tooth that when you bite on it, it's going to cause the walls of that filling to expand. If we had something in this room that was going to expand, it would cause the walls to expand out and crack perhaps the foundation or whatever. So biomimetic dentistry is not being taught in dental schools today much, and most dentists are not using biomimetic principles.
Is it like a 3D printer almost, or?
No, there is 3D printing. I'm glad you bring that up. You can do a 1-appointment crown, and we had that when you're working, Savannah.
Oh, wow. Okay.
And so you can scan teeth. There are some scanners and scan the tooth preparation and make the crown. I bet, Savannah made some, with the one machine
When
that we
I
had
moved to
at one time.
Michigan, we had one here.
Yeah. So that's, technology's really come a long way in dentistry. So that's good.
The last thing we're going to fit in on this episode is, so the goal is to find a 5-star dentist.
Yes.
How do we determine what a 5-star dentist is?
I think that instead of starting with dentists, that we should probably start with patients.
Oh, ourselves.
Yes.
Okay.
And the reason I say that is we have a tendency, we can either choose to be a victim or a victor.
And everybody's a victim now.
Everybody's a victim in dentistry. My dentist did this. My mama didn't take me to the dentist. My mom and dad didn't do this. I did that dentist. He did, she did, whatever they did. And that's ruined me. And it really does. I mean, if a patient's had a bad experience, that can be long lasting for them.
Of course.
But I think that there are 5 types. Well, there are 5 types. Well, there are more than that, but let's say 5 general types of patients. And a lot of dental offices don't maybe categorize their patients because we don't want to classify or
Profile them, right?
profile people
Yeah.
necessarily, but I want to know if this patient is harder to work on. If this patient has a real phobia, a real dental phobia, and cannot sit in that chair without screaming, kicking, jerking, grabbing my hand while the handpiece is running, that could injure them, I have to allow more time. We have to use more nitrous oxide or more pre-medicate them or whatever we might need to do, and it's going to take longer. So we're going to have to charge them more.
I always worry about what to do with my tongue.
Yeah.
The more I think about it, the more it moves and the more it gets in the way.
It's like all of us. Yeah. So that's a no in dentistry.
Yeah.
We don't even mention tongue.
Just to hold it and push it off to the side. Let me tell me to stop.
If we mention the word tongue to a patient, then that tongue starts going wild.
That's every time.
Yeah, that's normal. Everybody does that, I think. Well, maybe next time too, we could talk about some funny things that have happened in dentistry.
Oh, I'd love that. That'd be great.
And because you hear all kinds of things about dentistry, and I could try to think of a few of them that might be entertaining for people. But I think as far as how does the public or the consumer, why would somebody want to tune in to listen to another episode about dentistry? Well,
I've learned so much just about basic stuff. And I think we've built a foundation of who you are and your wealth of knowledge. And then we can throw in some funny stuff and some good information on the next one. That'd be awesome.
Well, I think we should, there should be something out there. I've thought about, well, where can I get my reference?
Mm-hmm.
So I'm going to have to write a book.
That's
That's
awesome.
all there is to it.
Yeah.
So that I can say, well, who referenced that? Where'd you get your reference? Who said that? And I said it. Well, how do you
Cite
know?
yourself.
Because I just thought about it. How does toilet paper relate to the cost or value of teeth? And so why would we use photography for diagnosing? Well, those kinds of things. So, well, what kind of dentists are there? What is a 5-star? What is a 3-star? Whatever.
Mm-hmm.
I think there are tooth dentists. I think there are teeth dentists. I think there are mouth dentists, and I think there are people dentists. And so we can get into that next time, but the end of this session or whatever, to say that the tooth dentist just works on one tooth at a time.
Okay.
And the patient is only concerned because they're event driven. I'll cover this again another time, but they're event driven, meaning the event was toothache pain.
Yeah.
A tooth broke, whatever. And so the dentist primarily just works on one tooth.
Mm-hmm.
He's just, when the patient comes in and gets their teeth cleaned, their dentist is looking for one tooth. Okay, which one tooth can I fix? Because that's all the patient will let them do, because that's all their dental insurance will allow them to do, let's say, if they have that mindset.
Yeah. And
so a teeth dentist is a little bit better because the teeth dentist is at least looking at a quadrant, a 1/4 of the mouth, instead of just that one tooth. What else is going on in that quadrant, or that's in a quadrant that's opposing that tooth?
Mm-hmm.
The mouth dentist is a little bit better because the mouth dentist says, okay, well, if you remove all these lower teeth on this side, then you're going to just be chewing all this on this other side. And is that going to cause you some joint related issues? Is that going to contribute to headaches? And then the last one is a people dentist. And a people dentist is looking at everything and looking at perhaps Botox, perhaps dermal fillers, perhaps TMJ stuff, perhaps headaches, perhaps airway, obstructive airway disease, and snoring. So looking at something besides just teeth.
Of course.
Many dentists, many patients say, well, I need to get my teeth cleaned, And that's all they think it is. I'm getting my teeth cleaned. Well, they should be, if they're going to have, I wanted my hygienist when I was working in private practice, I wanted them to have a discovery appointment. And I wanted to discover what's going on. So we checked the patient's pH saliva. So I wanted to know what the pH of the saliva was. I wanted photographs of them after they have used the disclosing solution so that we could show them on a camera, on a picture, the instantaneous, just boom, take a picture and say, well, you're not doing as good a job. Well, you don't have to tell them because they can see it for themselves.
Yeah.
And they go, oh, golly, I'm really missing back here. I'm bleeding back here in the back. How come that's bleeding? Well, you're missing this area. You're packing food because you're not cleaning it as well. You're not flossing, that sort of thing. So, we can go through that what kind of dentist is it? Because I think that's important. Ask those 4 questions we started at the beginning of this with, which are real important. So hygienist, how long are the hygiene appointments? Does the hygienist use lighted magnification? Do you use digital x-rays? Do you use intraoral camera? Of course, there are another 15 or 20 that I would want to put in there, but those 4, those patients could remember those. So, but you can tell I'm passionate about dentistry. I really want to try to, I want to try to improve the profession and get people to ask questions. That's all. Just ask questions with whichever dentist you're seeing. I don't want to badmouth other dentists. It's not an easy job.
And it's easy to get in the rut of, well, this is how we've always done it.
Yes.
And you've not done that. You've excelled and progressed and just really evolved with the profession. And that's awesome.
I've just wanted to, I've enjoyed running my mouth, as you can tell. And so part of that's wanting to, I guess, being around a father who was a football coach and a mother who was a high school English teacher. So when I was in practice, I would not try to run anybody down that I worked with, or worked with me who could put up with me. But if they were grammatically incorrect, so we done seen them over yesterday. I mean, that's East Tennessee to a certain degree.
Some of those are my favorite stories, though.
Well, but yeah, those are. So what do you think? Wrap?
I think that's great. Let's do it again.